Hi, I'm Dr. Randy Kamen. Welcome to Strategies to Spark Your Week. One of the most common reasons that people come to see me is that I specialize in stress, pain, and psychosomatic disorders. Frequently, I hear questions like, how do I deal with my stress level? It interferes with my work, my relationships, and most of all, in my own head. I simply can't juggle all the stuff going on in my life. Occasionally, I can get away for a couple of days, but as soon as I get back, within 24 hours, I find myself right back to feeling stressed and overwhelmed. A woman we'll call Michelle came to see me because she had anxious feelings on the job and at home. She chronically worried that things were going to go wrong, although she didn't even know what. Michelle's free-floating anxiety began to run interference with her relationships, her self-esteem, and her ability to concentrate. We needed to gain insight about where these feelings came from, as I always find that beneath the anxiety there is always a story and always more complicated feelings. But first, Michelle needed to learn how to manage her anxiety. Invariably, my first go-to strategy, especially when working with anxiety, is teaching people how to calm down, how to self-regulate, self-soothe, feel comfortable in their own skin. And this begins with the breath, the deepening of the breath. Breathing is the most basic function to us, and it is vital to managing stress and anxiety, and learning to self-soothe and self-heal. In fact, breathing is the one function that can be completely voluntary or involuntary. It connects the mind and the body, the conscious and the unconscious. It helps us to regulate physical and emotional pain. And best of all, deep breathing is a skill that can be learned. And with time and practice, it can become automatic and embedded in the brain. As baby, belly or deep breathing came naturally. You can see that when a baby is breathing, it looks as if their whole bodies are expanding and contracting. But early on, for some reason, we stopped doing this and we began breathing shallowly into our chests, which is indicative of a stress response. The general qualities to think about when breathing deeply are to make the breath slower, quieter, and more rhythmical. Modern science has shown us what the yogis have known for thousands of years. A slow, deep, quiet, rhythmical breath initiates a relaxation response. It evokes a feeling of authentic calm, gives us energy, and improves the ability to concentrate, bringing us into the present. To practice abdominal breathing, get into a comfortable sitting position. Place one hand on your belly and one hand on the chest. Make sure that when you breathe in, the stomach expands, and when you breathe out, the stomach or the belly is moving in. There should not be a lot of action in the chest. The chest is pretty quiet. Don't worry about your belly sticking out. If you lift up in the chest bone and relax your shoulders down, this will foster deep breathing while making you look and feel relaxed and self-assured. Breathe in and expand the low belly. Breathe out and empty your lungs and belly. As this is where the relaxation occurs, on the exhalation. And also, by emptying the lungs completely, you'll take in more air, and this helps deepen the breath even more fully. Breathing in and breathing out completely for a couple of rounds will initiate a relaxation response. Practice this for 2 to 5 minutes once or twice a day, sitting in stillness, and you'll notice the effects, especially early on in the initial stages of practice. Attention to the breath is the fastest way to manage stress and improve your focus in real time. Deep breathing not only helps us to relax, it also helps lower blood pressure, heart rate, it improves digestion, circulation, the immune system, and helps us with sleep. It calms us down, reduces anxiety, depression, stress, pain, and the management of difficult feelings. These are the same benefits that are derived from meditation. In fact, the breathing is often the point of focus in many meditation practices. We just watch the breath as we breathe in and out. And that is the focus in so many practices, but for some reason, the thought of meditating is daunting for so many of us. So if you could just think of it as abdominal breathing, breathing in and breathing out, you'll still get the same benefits, and this could never be overdone. The more you practice abdominal breathing, the easier it gets, and the easier it is to reclaim your birthright to be relaxed, focused, and energized. Michelle quickly learned the deep breathing, and her ability to self-regulate dramatically improved. Because the abdominal breathing helps us to manage stress and difficult emotions, it also helps to improve our capacity for healthier relationships. So all the way around, we stand to benefit. It's hard to believe something so simple can have such profound effects on the mind and body. Notice how you feel this week after practicing the belly breathing. And please let me know if you have any comments, questions, or concerns. I can be reached at my website, drrandykamen.com. And I look forward to seeing you next week for another episode of Strategies to Spark Your Week.